polio.
Polio, the virus which has blighted so many lives over the years through paralysis and even death.
In the early 20th century, polio was one of the most feared diseases, paralyzing hundreds and thousands of children every year.
So polio is a virus. It is part of the enterovirus group of the Picornaviridae family. The virus itself is spread, it's from person to person via the fecal-oral route, and humans are the only known reservoirs of the virus. Although the virus can be viable in the environment for a period of time under suitable conditions.
The National Institute for Communicable Diseases follows the World Health Organization program towards eradication of polio. We support the national and provincial departments of health to investigate any patient with acute flaccid paralysis to check that that patient doesn't have polio. There are many causes of acute flaccid paralysis. That means a sudden onset of a weakness in one arm or one leg or any part of the body. So in any patient who has a sudden onset of weakness of part of their body, they send a sample to the National Institute for Communicable Diseases, and we will investigate for polio in that patient.
The National Institute for Communicable Diseases, a division of National Health Laboratory Services, is South Africa's principal institute for surveillance, identification, and prevention of infectious diseases. Within the NICD, the Center for Vaccines and Immunology undertakes research and surveillance. It forms an integral part of the global polio laboratory network and is the only laboratory in South Africa that processes samples containing wild-type polio virus and is the only sequencing polio laboratory in Africa. The NICD presents a tribute to the progress made to date in the fight against polio. Decades after having contracted the disease, these are some of the survivors that we have followed.
At a tender age of 6 in 1982, when I was visiting my grandparents in a village called Nkabele. I started feeling, one of the days, experiencing weakness on the lower part of my body, especially the knees. You see, as a young child, you don't get to understand these things as to what could be happening in your body. So that's how it was starting actually to attack my body. My grandmother realized that no, there is something wrong with this child. Then you see, back then there were no many people who understood different symptoms of different diseases. So maybe what was going on in their minds was it could be experiencing maybe just mere simple symptoms of your normal cold and flu, things like that. Then my late grandmother, she then made contact with my mother to actually get me to a hospital, because they could see that actually these things were starting to get worse. Okay, I was hospitalized in 1982, and back then at the hospital that I was admitted to, there were not many doctors who were experienced in many diseases or treating many diseases, maybe similar things like what I was going through. But I think I was one of the lucky patients who was then treated by, he's now a professor, then was a doctor, Dr. Say, who actually picked up on his diagnosis that this child, whatever it is that was going through, was as a result of polio, post-polio myelitis. I was hospitalized for 2 full years. I was, if you just sleeping in bed without even being able to turn your head, nothing. All I could do was just to talk, but I couldn't even move any part, even my fingers. I couldn't feel anything.
Well, there were two of us when I contracted the disease. My sister only 2 weeks old, which meant that I had to go into an isolation ward. I contracted the disease in 1956. There was a large epidemic in South Africa, summer of 1956 to 1957. So I went into an isolation ward in Mthatha for a month to protect my sister, as well as to discover what was wrong with me. They didn't know if it was meningitis or polio. Thereafter, I went to an orthopedic hospital in East London for 7 months and made a partial recovery, but was left with disability in my left leg.
In 1953, my family, which is my dad, my mom, and my elder brother, relocated to Port Elizabeth, where I was admitted to the local hospital for tonsillitis. I was put in an open ward, and the night before my operation was due, another kid lying in the open ward next to me died of polio that night, and he, I believe, was the last surviving, or the 5th brother that died of polio in his family. And because of that death, my operation for tonsils was postponed, and I was sent home for observation. And about, if I recall, about 2 weeks after that, I was on Humewood Beach with my folks when my legs gave in, and I was rushed back to actually the same hospital. But now, instead of being put in an open ward, having contracted this deadly strain of polio, I was put in a total isolation room where I only had a brick window of glass, and that was the only thing that could open and where I could see anybody. But I was totally paralyzed, I was told. I don't have much recall of my recovery days, early days, but memories started flooding back when I could remember when I started getting strength in my arms, and I could actually move my head and be able to look at the window where I saw my parents and my brother, one at a time, because of the smallness of the window.
I was born with no polio. I was born like any other kids, and at the age of 2, when I was starting to walk, about that, yeah. I think that I walked, and then after that, according to them, there was an outbreak, polio outbreak, I think in 1970, because I was born in 1968. So in that outbreak, and it affected me, and it also affected my father. According to my parents, they say I was admitted at the same time with my father. For my father, because he was old enough, I think he managed to not to be affected as me. For me, that they have to do the operation, of which it make it worse rather than solving the problem. And I think it's because the doctors by the time, they were not sure what is the problem, because they say I lost the strength or whatever, the balance on my muscle. So my muscle and my joint were weak, so I couldn't walk properly. So they tried to do the operation on my right leg, which is affected most, trying to find out the problem, of which it didn't address it. So I ended up sleeping in the hospital. I remember very vaguely in the hospital when my grandmother and my mother used to visit me, and I was with the other kids, playing and. So I think I stayed there until I was 6 years old.
So polio can cause irreversible paralysis. So usually it's about 1% of the cases that will show symptoms of polio. However, the paralysis that's caused by polio is irreversible. So that is why there's a global eradication program to make sure we get rid of the virus globally.
One of the days I had, just a chat, a casual chat with my late mom to try and understand as to what actually led to this. It wasn't easy for her to actually share with me, but she had to tell me the truth. Well, you see, it's said that I could not get the immunization for polio because my mom did not have 5 rand. Now, you see how hard it was back then. Just to get 5 rand to transport a child to a clinic, just to get an injection. So now, that 5 rand led to all of this. I couldn't get immunization.
I started school late, and also I was using crutches. And for me, it was not easy to play with the other kids as well. But being free-spirited, I could go out and play whatever I could afford to play at my childhood age.
First day I was taken to school, my mom had to carry me on her back to take me to school. I didn't have a wheelchair. Now, for children to see this child being carried on a back of a person coming to school, that was strange to them. They would look at me like this, wondering as to what's happening, what's wrong with this fellow child who's not like us.
Polio survivors confronted the challenge of reconstructing lives so abruptly altered by the disease and finding ways to live and succeed in school and work.
I remember it's primary school. This is a such story for a grown-up woman. I remember we were playing with the other kids in the morning, and this old mama, who was the teacher. So we were playing, and we couldn't hear the bell ringing. And he called my name. He said, "Hey, when I'm gonna matela with 4 legs." I had, I had that anger and that unforgiveness, and I was crying. When I arrived home, I said, "Mama, Mrs. Dooley said I'm with 4 legs. Can you please go confront him?" I mean, being parents, they didn't confront him, but my grandmother, who was so fond of me, confronted her, and then I don't know what she said to her, but eventually she apologized. So those were the negative comments that I got.
And you see, for them to get to understand this, it took them time. But lucky enough for them, with me being integrated, it being part of them, it made them understand and realize that no, it's not like I'm a different, a human being from them, apart from the fact that in terms of mobility, they could walk with their own legs. I could not walk with my own legs. I had to use a wheelchair to move from point A to point B.
From the other kids, I remember one said a fight with another kid, a fight. I remember I took my stick and I hit the girl on my hand. So otherwise, they never. I can't remember being discriminated by other kids. In my family, I was never even one day left alone because of like that, or being kept in the room locked inside because of that. No. Otherwise, I was the apple of my father's eye.
I don't remember much when I was actually admitted with polio, but I know for a fact from what I was told that I was absolutely, totally paralyzed. So maybe that's also a reason why I don't have much memory of it. I do recall when the nurse and the doctor entered the room and tried to make me walk, and initially I couldn't. The days I actually started giving my first steps towards the doctor was the day I started my recovery. In total, I spent about a year in that hospital.
After having lived in their unfamiliar impairments for decades, polio survivors discovered that, at their dismay, their bodies were failing them once again. Many began to experience new pain, fatigue, and muscle weaknesses, and that is called
post-polio, which emerges when you're about, depending on when you got it, about 40 years later, where suddenly you have loss of function. You have breathing problems, swallowing problems. Not everybody, but some people have really a worsening of their symptoms. I have experienced suddenly a loss of function, which has been quite a shock to me. And then you have to be very careful of falling because you injure yourself, break bones. I've broken my femur and really damaged my ankle.
I don't have much impairment except in my eye and some muscles in my back, which is not really noticeable. But this was only discovered later in life when I was in Cape Town at the hospital because I had started getting spinal problems. And I've established that there were some muscles missing in my back that never recovered properly, and I have a deficiency in one of my eyes, for which I now have to wear glasses. But that's the only impairment that I have.
My mother says that she didn't realize the emergency of getting me vaccinated. I've subsequently learned that the Salk vaccine was declared safe in South Africa in April 1955. But living in the Transkei, there wasn't a rollout of this vaccine.
Polio has no known cure. The only method to prevent is through vaccination. So parents should make an extra effort to have their kids vaccinated. Vaccines are administered at birth, 6, 10, and 14 weeks of age, and at 18 months. A booster is given at 18 months. So parents should be encouraged to ensure that their children are vaccinated fully with polio.
Vaccines have been widely praised by the scientific community and public health officials as one of the greatest medical breakthroughs of the modern era. Their importance cannot be understated. Vaccines have saved hundreds of millions of lives since their first introductions in the 18th century.
So here basically polio is related to AFP surveillance. So the idea is to have a very good AFP surveillance system. So the laboratory will then test samples that are collected from patients who have symptoms of acute flaccid paralysis to exclude polio as the cause of the symptom. It's fecal samples that are collected. They should be collected within 14 days of onset of paralysis, 24 to 48 hours apart, and sent to the laboratory for testing. So we then process those samples, inoculate them into tissue culture, and observe for specific cytopathic effects of the virus.
We conduct a lot of the laboratory work that goes into polio surveillance. So if any patient gets sick with a sudden weak limb in any hospital in the country, the doctors will send us samples from those patients, and we will process and culture those samples for viruses. The procedure takes up to 2 weeks just to get the results as to whether there is a virus that has been cultured in those samples or not. And then we do molecular testing, including viral sequencing on that DNA or RNA from the virus. We are the only polio sequencing laboratory in the African region. We process work for a lot of our neighboring countries and much of the SADC region and beyond, including Namibia, Botswana, Mozambique, Lesotho, Swaziland, and certain work for other countries such as Angola and Uganda. We are involved in reporting our findings to the World Health Organization and to National Department of Health.
Since 1988, the World Health Organization has organized an immunization program to remove polio virus from every country in the world. This program has been very successful, and polio virus is now only a problem in a few of the countries.
Okay, so we are trying to eradicate the virus. The virus can cross borders. It doesn't need a visa to cross borders. There are 3 endemic countries globally at the moment, which is Nigeria, Pakistan, and Afghanistan. So the viruses can be imported into the country, and therefore in an area where there's low vaccination coverage, the virus can be transmitted from person to person.
So the legacy of polio, in fact, is very interesting just in terms of our own institute. Our own institute was developed through funding raised in the fight against polio in the 1940s and 50s. So in the 1940s, there was a very famous fundraising initiative started in the USA called the March of Dimes, initiated by President Roosevelt, who was himself a polio survivor. And the South African version of that fundraising effort was called the Snowball Procession. And in fact, it was funds raised by the Snowball Procession that allowed establishment of the Poliomyelitis Research Foundation and development of the infrastructure that you see around you in our institute today. And that institute eventually became the National Institute for Virology and later on the National Institute for Communicable Diseases.
Yes, there is life after polio. If you actually want to succeed, you just need to push. But of importance, parents need to ensure that they take their children for immunization. It's very important. It's really not worthy to have your child's life wasted. To actually let your child go through all of this. Today we have the clinics, there's everything. We have, one of the best health facilities, we have the best health system. These things, can be prevented. I wouldn't want any other child in South Africa or the world to go through what I went through, because it was just a mess.
Having recovered from a deadly strain of polio, I consider myself extremely lucky, like second chance at life. And I would encourage everybody to be vaccinated. And this process must never stop, because this disease must never come back. I've had a very active and fulfilling life after polio. But like I say, I was extremely lucky.
I would emphasize getting vaccinated with everything I've got. One child getting polio is one child too many. It concerns me enormously that there's a movement at the moment not to vaccinate against anything, the anti-vaxxers. And what I want to say to them is that I'm an inconvenient truth.
So the last confirmed polio case in South Africa was in 1989. So that's almost 30 years since we've seen a polio case in South Africa.
Polio is targeted to be the second human disease ever eradicated through vaccination. That means one day after we are finished the fight against polio, we will be able to stop vaccinating our children. But until that day, every single child needs to be vaccinated to prevent one traveller bringing polio back into the country.